Hey guys, Dr. Davin Lim, board certified dermatologist. Today we'll be talking about how to treat pigmented acne scars, also known as post-inflammatory hyperpigmentation. So we'll talk about a few things, including how dermatologists manage it, laser treatments, as well as DIY home treatments and what you could try or should try at home or consider at least prior to seeing a dermatologist. So what are pigmented acne scars? Basically, they're called grade 1 scars, and they can be classed as PIPA, so post-inflammatory pigment alteration, but also post-inflammatory hyperpigmentation. When it comes to hyperpigmentation, it describes dark acne scars, whilst post-inflammatory erythema, or PIE, stands for red acne scars. So in today's video, we're talking about pigmented acne scarring. Now, the first thing to understand is prevention of acne itself. And the way to actually do that is to find an effective treatment that's probably medically based to decrease the amount of acne, because this way it stops the cycle of having acne, inflammation, and then post-inflammatory hyperpigmentation. Because with post-inflammatory hyperpigmentation, it can take up to 5 years or longer before that goes. So effective management of acne is super important, and placing it in remission is very important at the same time or very close to the time of treating your dark acne scars. So that's number one. Number two, something as easy as photoprotection using sunscreens. And the most important sunscreen ingredient to use, especially for skin of color, is that of iron oxide. The reason being is that iron oxide itself, found in tinted sunscreens, protect against what's known as HEV, or high energy visible light, which includes the blue light spectrum, which can stimulate pigment. So not only do you have to use a sunscreen that protects against UVB, UVA, but also visible light. And the easiest way to do that is to find something like a physical sunscreen which contains titanium dioxide or zinc oxide, plus importantly that secret ingredient, which is iron oxide tint. You can also go for a chemical sunscreen with iron oxide. So guys, tinted sunscreen is super important. From there, you can use certain topicals, and the topicals that you can use include things like your retinols, but also your ascorbic acid, your niacinamide, hydroquinone, arbutin, and a whole heap of botanicals. So they can be bought over the counter. If you're looking for something to start off with, a good formulation is something like ascorbic acid between 5 to 20%, preferably with a little bit of arbutin in it as well. You can also go for a pigment inhibitor that also stops acne from coming out, and that includes things like your azelaic acid. So any formulation between 10 to 20% azelaic acid at night is great, and then you can use an ascorbic acid before using your sunscreen in the morning. From there, what do dermatologists use? Well, from there, dermatologists can employ chemical peels or lasers. The chemical peels, which can be helpful, include things like your alpha hydroxy acid peels or your salicylic acid. Now, in the context of pigment, generally speaking, your alpha hydroxy acids, which is your glycolic and your lactic acids, are better compared to your salicylic acid. Your salicylic acid is known as a beta hydroxy acid, is more useful to treat acne itself because it can reduce inflammation, but also it can help exfoliate your skin. And when that happens, you can treat acne, but can also exfoliate your skin to improve with your skin brightening and lightening and decrease PIH. So my preference, glycolic acid peels over salicylic acid. However, what's been shown in the literature is that salicylic acid, especially in higher concentrations like 20 to 30%, can actually exfoliate skin and brighten skin as well, sometimes equally as good or if not better than alpha hydroxy acids. Another favorite peel that dermatologists use is something called a retinoic acid peel, and we use concentrations between 0.5% all the way up to 5%. And with a retinoic acid peel, that can also reduce the amount of acne, but also treat pigment as well by exfoliating your skin. From there, you can use novel peels, and novel peels include things like the V Precision peel, Cosmelan, and the more powerful Dermamelan peels. There's pros and cons for using these peels. They're generally speaking more effective than your alpha hydroxy acid peels or your salicylic acid peels. The downside is the cost, so they do cost more than a series of AHA peels. And the downside with these novel peels is that you do have what's known as downtime. So with the Derma and Cosmelan peel, your downtime can be as much as 2 weeks, and hence my preferred peel is the V Precision peel, because the downtime for that is limited to around 3 to 4 days at most. So from peels, what do dermatologists employ? Lasers, and the lasers that we use include things like pico lasers, and the lasers which I use include things like your PicoSure, your PicoSure Pro, and also your other lasers like your PicoWay. They offer a really good pigment reduction within a short period of time. When I mean a short period of time, most patients see changes within 1 or 2 sessions. However, most patients will benefit between 3 to 4 sessions, and each session spaced between 2 to 4 weeks apart. So they are by far the most effective way of reducing pigment. Other lasers include things like your old-fashioned Q-switch lasers, so things like your Hollywood Spectra, your C6, your Revlite, and a few others as well. From there, fractional lasers, but the fractional lasers, generally speaking, are not as efficient as pico lasers. So the fractional lasers include things like your Laser MD, your Laser MD Ultra, your Clear and Brilliant, your Moxies, as well as your fractional Fraxel lasers, as well as other lasers in the thulium, as well as the diode type drivers. So anywhere between wavelengths between 1927, 1940 all the way up to 1540, 1550 non-ablative lasers, fractional lasers can be effective, but generally speaking they'll require 3 to 5 sessions over a period of months. So my preference for lasers, by far and away, it's the pico laser that's going to give you the best response. Okay, so now we talk about DIY tips. Last year you might have seen my video on the Banisher 2. Well, now they have a new version called the Banisher 3.0. So what's new? Well, unlike previous versions, the 3.0 comes with 2 replaceable heads, meaning it lasts twice as long. With the replaceable heads, a safe at-home microneedling session typically ends up costing less than buying a cup of coffee. This is how you do it. After 8 uses, you simply snap off the replaceable head and put on a new one. Easy as that. Why do I recommend replacing the head after around 8 sessions? This is because of sanitary reasons and also to prevent blunting of the bristles itself. This goes for any microneedling type tool that you have. Additionally, Banish offers topical products that complement the microneedling process, such as the Banish Serum, a dark spot corrector enriched with vitamin C, vitamin E, and ferulic acid. Applying the Banish Serum can enhance the benefits of microneedling, especially when used in conjunction with a stamper. It's important to note that Banish makes fresh batches of L-ascorbic acid vitamin C serum to order daily, so that your serum arrives fresh, effective, and importantly, non-oxidized. Guys, this is why I prefer a stamping tool over similar rollers. A stamping tool is far safer, it's far more accurate, and gives you much less trauma compared to a roller, which may rip and cut. So above all, a stamping for me when it comes to microneedling is the gold standard. The needles on the Banisher are one of the thinnest out there, and this makes it both a safe and effective treatment for at-home use. 0.5 millimeters is best for stimulating collagen. Anything above this can induce unnecessary trauma to your skin, which may lead to paradoxical scarring. Because of the design and length of the bristles for the Banisher 3.0, anyone can safely and effectively use this treatment at home. Just follow the instructions. I want to emphasize a fundamental aspect of at-home skin and microneedling: safety. When embarking on any DIY skincare journey, ensure that your chosen tools and products prioritize safety as their paramount motto. Throughout the discussion today, I've highlighted the critical importance of choosing reliable and safe tools for at-home microneedling. The Banisher in this regard stands out as the brand that prioritizes your safety. If you're ready to invest in your skincare journey and save some extra money, you can use my code Davin Lim to save extra money on the Banish Kit 3.0. So guys, that's a quick summary of how to treat post-inflammatory hyperpigmentation. From there, your dermatologist may include certain things like tablets called tranexamic acid to help reduce really stubborn areas of post-inflammatory pigment. I hope you liked that video. It's a quick summary of how dermatologists think when they treat pigmented acne scarring. I hope you liked that DIY tips, which has been brought to you by Banish.